hiatal hernia is when a part of the stomach moves up into the chest area. Normally the stomach sits below the diaphragm. The diaphragm is a layer of muscle that separates the organs in the chest from the organs in the belly. The esophagus, the tube that carries the food from the mouth to the stomach, passes through a hole in the diaphragm. In people with hiatal hernia, the stomach pushes up through that hole. There are two types of hiatal hernias. A sliding hernia, this is when the top of the stomach and the lower part of the esophagus squeeze up into the space above the diaphragm. This is the most common type of hiatal hernia. Number two is a paraesophageal hernia. This is when the top of the stomach squeezes up into the space above the diaphragm. This is not as common, but it can be serious if the stomach folds upon itself. It can also cause bleeding from the stomach or trouble breathing. What symptoms will you experience with a hiatal hernia? A hiatal hernia does not usually cause symptoms. In some cases, though, it can cause stomach acid to leak into the esophagus. This is called acid reflux or gastroesophageal reflux disease. It can also cause symptoms like burning in the chest, known as heartburn, burning in the throat or acid taste in the throat, upper abdominal pain or chest pain, trouble swallowing, unexplained cough, a raspy voice, or a sore throat. How do we diagnose a hiatal hernia? In most cases, people learn they have a hiatal hernia when they're having tests to find the cause of symptoms or for other reasons. For instance, some people find out they have a hiatal hernia when they get an x-ray. Others find out during an upper endoscopy. The upper endoscopy involves putting a tube with a tiny camera down the throat into the stomach. How do we treat a hiatal hernia? People who have symptoms caused by hiatal hernia can get treatment for their symptoms. Treatments for symptoms involve taking the medications that are used for acid reflux. People with a paraesophageal hernia and some people with a sliding hernia need surgery. For this surgery, the surgeon pulls the stomach back down and repairs the hole in the diaphragm. This way, the stomach does not slide back up again. The most common surgical procedure is called a laparoscopic toupee fundoplication. The procedure is completed minimally invasively, typically with 5 small incisions. The procedure involves bringing the stomach back down into the belly, repairing the diaphragm and the hernia, then wrapping the upper part of the stomach around the lower end of the esophagus. Complications will include difficulty swallowing, feeling bloated, called gas bloat syndrome. These symptoms may resolve over time, but can persist. Recurrence in 10%, 2% get lung infection, blood clot, or heart complications, or leak. Most people, however, say they are very satisfied with the results of the surgery in the long term.